Good to be with you, Maritza. Uh, could you start with introducing yourself?
Okay, my name is Maritza Pintado. I am from Peru. I am neurologist. I am a Track Fellow for Equity in Brain Health. I was part of the 2018 cohort based in San Francisco. I was part of many groups in the Memory and Aging Center when I was doing my training there.
And you've been very busy recently with work on the National Dementia Plan in Peru and some follow-up to that. Could you give us a high-level overview of the work you're doing related to the National Dementia Plan in Peru and what the goal is of the group?
Currently, I am working closely with the Ministry of Health of Peru, writing some normative papers related to the dementia plan for Peru. And we started that work the 3 last months of last year, and we are very focused on trying to have ready these documents to write then the guidelines for the dementia plan for Peru.
So you mentioned the Ministry of Health is the one that organized this group. Can you say a bit more about how it came about and other stakeholders, other groups that might be involved in this process?
I have to say that 2 years ago, in 2024, no, 2023, I met some people from another project, big project for Peru, the Impact Salud Project, which is a group who is working on dementia, doing research across the country. And then nothing happened in Peru. We have the regulations and the law for the dementia plan since 20, 2013, I think. And since that time, nothing happened in Peru. So for many years, we were asking, what about the plan? And we don't know exactly what's going on with the plan, right? In 2023, I received a call from the Ministry of Health to write the first draft for caregivers and caregiving in Peru. I didn't know how they have my name. I didn't know how well connected with me. And for the first time, I was the connection with people who is working on the dementia plan. When I arrived there, obviously they asked about who I am, my curriculum, my background, and everything. And I started to talk about GBHI, brain health, dementia, the word, and all the knowledge that I had already because I was part of GBHI, right? And they were a little bit curious and surprised about who I am, who is this person, right? Because they didn't know about the program, they didn't know about brain health exactly, or all the knowledge that we have now around the world, right? So I started to write that first document as a draft. And then I started to use another kind of language, right? Because I was part of the GBHI fellow. Then when they read that document, they started to know about what is about brain health. Why not just mental health? What about
Mm.
just brain health? What about caregivers? And what about just, I was changing some words about, no, we don't need to provide training or just training. We should provide support and companion to that families and caregivers and everything. I started to change a little bit the words and the statements and the knowledge. And they were more curious about what about this kind of new approach? So I started to share with the Ministry of Health about GBHI. And they were seriously, I was feeling really supported by the knowledge I received in GBHI. But I was trying to connect the that offices, the Ministry of Health with GBHI.
Mhm.
Then because some management, like bureaucratic management and budget issues. That connections was just for 2 months. I was working with them just for 2 months. And then suddenly everything finished. When I asked again, please, we need to continue doing that work. But they said, "I'm sorry, but we don't have the budget to pay for your work. We don't have more time to work because it was the end of 2023.
Mm.
So we started to have more conversation, but trying to connect different people. For
Mm.
example, I met already the people from the Ministry of Health. I met people from the Impact Project, but and I was part of GBHI. And then I felt very supported for Victor Balcour and Camelia and other people around me. I was asking for help. Hey, this is a good opportunity to meet people there. I already met people there, so we should continue conversation about the dementia plan. We were in conversations for more than 6 months, maybe, trying to meet each other and trying to realize how we could collaborate with each other. And then after all these conversations, we 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 formed a team from
Mhm.
the impact team, from the MINSA team, Ministry of Health team, and also from GBHI. And we started the work.
And so that was in 2023 and
2024.
2024, and
Yeah.
then that eventually culminated in a workshop that you had just last month. Is that right?
Yeah. That was part of the work because we started to work on the normative documents, which is
Okay.
very bureaucratic ones. We have the knowledge according to dementia, brain health, and everything, but we didn't know how hard could be work with this bureaucratic
Hmm.
part of the country. This is they have a different kind of structure. They have a different kind of process.
Is it the
Uh,
Ministry of Health or what group has the
Ministry of Health,
yeah,
the
yeah,
Ministry of Health, they have a different one, right?
right.
I never worked before with this public system in this kind of administrative and bureaucratic part. I never
Yeah.
worked before, so I didn't know. So, um, so we try to put together like the experts, me and Marcela Mar, also from GBHI. She is part of the 2019 cohort. She is a geriatrician, and she already has more experience working with the Ministry of Health. It was very, very nice because she already knows many kind of this kind of regulations.
Hmm.
So Marcela and I, as fellows, other people from the impact team and other people from the MINSA team, we were working as a team the last 3 months, working in the first documents before the normative documents, because they have like a process to write this kind of documents. And we are in the process now. At the same time, we have the good opportunity to have the support from all the people from GBHI, like Sergio Lanat and other people. We prepared this big meeting on February, this last February, because we noticed the need to put together all the people interested in the same goal. But these all people don't meet each other before, or maybe yes, but never
Hmm.
talk before together in the same topic. So it was very great to have people from Peru working in the same field with the same purpose, but talking for the first time,
Hmm.
many of them, and everybody realizing that, hey, we have the same purpose and we are working separately. why we are doing these kind of things. So that was good to have people there and trying to collaborate and sharing knowledge, sharing experiences, because all of them has a lot of experiences, different ones, but all of them are very useful for that work.
What are the different types of people or groups? Are these physicians? Are they scientists? Are they policy folks?
Yeah, they were like researchers, people who are doing, they have research teams in
Mhm.
Peru, working in Peru, based in many places of Peru, doing research for many years. For example, we have people, clinicians, working in different hospitals across the country, or working in different kind of system of health across the country. We have journalists like Susanna Lai from GBHI and other people invited. We have Alex Conhuber, also from GBHI, and also another people working in the same field in Peru. We have caregivers, we have nurses who are providing training for caregivers, and they didn't know that we were working in the same field,
Mhm.
which is that was important to meet each other and try to connect people, um, to have the support, the real support that, hey, I am not alone. They are not alone. We could work together. That was the purpose of the meeting, and I think that was a very successful one. Everybody was very happy and sharing the work that they are doing and trying to connect uh, with each other to do more work in Peru. That was
Mhm.
the main purpose of the meeting, and I think we we accomplished that goal for that step.
That's
Because
terrific.
after that, a lot of suggestions emerged, a lot of questions too, and also another kind of goals we have now for the future.
Right. And I want to get to some of those goals in just a minute, but maybe to circle back on your experience with this. So it sounds like you're doing some writing and framing some of what will come from this, next steps, but also it sounds like there's some coordinating that you're doing and working with different stakeholders. Could you speak a bit about the role that you've been playing in all of this a bit more?
Like coordinating, yeah, it was a little bit, I think that, I don't know, is when everything in life uh, uh, emerge and suddenly things happens. I was feeling that because when I started my training in GBHI in 2018, I was looking for people in the Ministry of Health to ask about the dementia plan. I didn't have any kind of good response in that
Mm.
time. But now, also as part of GBHI, I asked again, and I found the right people in the Ministry of Health, and they were open to share. They were open to respond to my questions, and they were open to ask for help. That was good because we were there to provide that help. But also we found another people very connected with the Ministry of Health, which is Impact Salud. That people are very really good connected
Mm.
in Peru with universities, with the Ministry of Health, and also they knew before GBHI. So when I was there, we realized that everybody knows each other, but we didn't connect before. And that was good to start the connection in that time because the Ministry of Health, they need to write and they need to put in practice the dementia plan, but they didn't know and they didn't have the experts on dementia, for example. They didn't have that. So we were waiting for the opportunity to work on that plan, but we didn't have the connection before with the
Mm.
Ministry of Health. We have the knowledge on dementia, yes, we are maybe the experts on dementia, but we didn't have the connection into the Ministry of Health, right?
And did you feel
When
that so it sounds like it was helpful to have an association with GBHI, with Impact. and that was important to engage with the Ministry of Health.
Yes, of course. And like everybody was hoping to have the connection, and then suddenly everybody was connected, and that was good to have the opportunity to be connected between us.
Yeah. And so you started talking about, or you alluded to some goals and what's going to come next. So you had this workshop in February, bringing together all these stakeholders that were in the same area but hadn't been talking to each other, and some goals and ideas had emerged. So where does the plan? What comes next from this workshop? Is there uh, target dates for a plan or some of these intermediate steps?
Yeah, first we collected all the information from that workshop. It is been now very helpful because we are trying to manage that data, also to to use that data to write the normatives documents, right? This is one. Then we are planning to have a next meeting, maybe in May, to have the same people and also more people, involve more people to have more feedback, more knowledge, more people who has in knowledge to provide in the room. This is the next step. And then as a group, as a small team with the MINSA team and also from GBHI, we are writing now and we are going through the process to write the normatives. But more than write the normatives documents, we need to the approval from that Ministry of Health. So this is a long process, I think. I hope not. But we are, yes, because this is a little bit bureaucratic one, we need to write and then we need the approval. Or maybe not, we need a feedback and then
Mhm.
rewrite and then get for the approval. So this is a process that going back, going forward, going back and going forward. So I think then the biggest step for us is to have the approval of the normative documents in the following months to go to write the guidelines for the dementia plans.
Mhm.
Without the normative documents, we can't write the guidelines. And without the guidelines, the plan, the dementia plan can't go in practice. So
Mhm.
this is step by step. So
Yeah.
my main goal in the following months is to have the documents written and approved, to write the guidelines to have
Mhm.
the dementia plan in practice. This is the
Understood.
main goal,
Right.
and maybe in the future to have a better approach as a country, a better
Mhm.
approach to dementia with using this dementia plan.
Could you say a bit more about these normative documents you're referring to? Uh, what are they, or what areas do they focus in particular areas?
Yeah. For now, I was mentioned that when we were in touch with that MINSA team, they were needing to write like 4 documents related to diagnosis, related to caregivers, and with patients, and also
Mhm.
related with how to care to caregivers, and also how to implement and provide training for people who is working on the primary care centers in Peru, right?
Mhm.
All of that 4 objectives or 4 big goals needs to write before of everything this kind of normative documents because they need that before to put in practice everything. So
Mhm.
for now, the means Marcela and I, we are working on the caregiver document and also in the diagnosis document for now. And then maybe we could work in the other 2 parts to provide training and to caregivers.
Got it. And so then once those are done, then that can then lead to guidelines for the dementia plan and then the fuller writing of a dementia plan.
Mm.
It's exciting. It's exciting that this is happening. Just wondering, after so many years, and when the Ministry of Health contacted you, was there, why did it become a priority for them again? Was there a different Minister of Health? Was there broader leadership change? Or any idea what the factors were that led for this to become a higher priority issue again?
If I can say that it was because of political decision, no, because politically my country is passing a really hard time because the politicians are doing other kind of things. They are not like regulating this kind of important topics. They not seriously. Politically, my country is like changing ministers or people who is in the power like every 2 weeks or every 2 months. This is not a good time for us as country. But what was helpful to have, I think, to have the openness of people who was from the Ministry of Health, who they have like a permanent position there working. They can be changed because political decisions. That was good to have this kind of people working there. And the good things, they were open to ask for help.
Mhm.
Before that, we couldn't introduce ourselves just, hey, I am from GBHI, I could help you. No, that was a little bit tricky in the past years, but now they have the openness to ask for help, for help in terms of expertise on dementia. And also because this other kind of international support from these kind of international researchers are coming to Peru, right? Like the Red Lab or
Mhm.
Impact team from London, other people working, trying to do research in the country. They are like having a lot of visibility, right? Working on dementia. That was good. And then we were, as fellow from GBHI, we were like also able to say, hey, yes, we can help. So everybody put a little bit of openness and and try to do something together. That was a good time to be together and try to do something else. I
That's
think that
great.
far away from the political decision
Yeah.
that many countries are
Yeah.
passing.
Great. So I also wanted to ask a bit about your own experience with this, and had you engaged in policy before, and also why did you want to get involved in policy and in this process?
No, I didn't were involved in policies before. Not this is not my expertise. I think I am now like an expert in dementia in my country. This is because I am from GBHI. I am really proud about that. But in policies, no, this could be my first time working on. But why I was looking for this kind of opportunity? Because I think because this is more than a personal goal, could be. Because before GBHI in 2017, before I applied to GBHI, I had some experiences working in public health when I realized that challenging way, I had some challenges working in the public health system.
Mhm.
I was as a neurology, I was working in a small city in the southern part of the country. So when I arrived there, some people in power, like the regional director or something, they mentioned that one, they don't need neurologists working in this kind of regions because they don't have neurology diseases. not true.
Right.
And then when I asked for a permission to go to develop my training in GBHI, they say that they can't provide me the permission because they don't have dementia as a priority, because dementia was not in the statistical data from that region. So, which is not true too. So I was a little bit frustrated in that time because I didn't know how to change that. I didn't have the knowledge that I have now. I didn't have the training that I have now. So there was a reason why I applied to GBHI. So after, when I came to Peru, after my training, I was trying to connect people with other, trying to change that kind of misunderstanding that we don't need neurologists, or we don't need to work on dementia topics because we don't have that as a priority in the data. Obviously, this is not in the data because nobody, or we don't have the experts diagnosing this kind of diseases, right, in the community. So that is the reason why after GBHI, I was trying to connect people every time, connect people. And also people were looking for my expertise or people from GBHI to work together. And then again, suddenly everybody I met the right people who were open to write with other people. So I think that was how I was there trying to connect people, and I was there to start the conversation and to start.
Mhm. Do you feel that your experiences and the things you learned as a GBHI fellow helped better prepare you or enabled you to play that role and engage in policy?
Yes, of course. Yes, of course, because personally, I had to be very conscious about, for example, first, my expertise now in dementia, not just as a neurologist, not just as a clinician, but also as part of GBHI. This is different. And also trying to be conscious to approach and connect with people with my knowledge and expertise, but also with diplomacy and humility, right? And I need to be very conscious about what is the main goal. The main goal is not Maritza is working and looking for work to have a salary. It's not the purpose. The purpose is to have something good for the country, and we could contribute together because all in that team are experts. I'm the expert on dementia and the clinical work. People from the MINSA team, they are expert doing this kind of regulatory and normative bureaucratic work. They are the expert, and also they have the power to write, to send, to regulate this kind of normative. They have the expertise and the knowledge. So if we work together, we could have a better result, a better a better results
Yeah.
for yeah. So I think that was all these new skills that I have now. That was because I'm part of GBHI, and also I have to say that without GBHI, I can't be part of that team. Because when I was saying, hey, I am Maritza, yes, I have the knowledge, yes, I could help, yes, but it is just Maritza. But they are big institutions. They are working with other kind of, I don't know, approach. But when they knew that we are supported for GBHI and which kind of work GBHI is doing, they started to provide us also, they believe on us, they trust
Mhm.
on us, and they are confident now on us because we are not alone. We
Yeah.
are big institution, a global one. So they feel that more confident working with us because that.
Encouraging to hear and really inspiring work that you're doing. And one final question. It's for current fellows that may watch this or that may come and speak with you. Do you have any advice for fellows who might want to establish a dementia plan in their own country, or for fellows uh, more generally interested in engaging in policy?
Yeah, I think that uh, don't don't give up looking for people to help you. I think was key for me. When I came to my country, I was trying to connect people. I have so good responses, like saying, "Hey, yes, we can do something." And other responses are, "No, this is so difficult. Forget that. Don't do that." Right? You will have this kind of responses. But if you are clear about what is the main goal, you consciously are looking for people to help you every time. And that people are there. We just need to find them. That's it, to find the right people. Don't give up looking for that people. And when you find that people, please be conscious about your words because many of them don't have the same knowledge, they don't have the same experience that you have, they maybe are not understanding completely what's going on with GBHI or your purpose. But if you go in a clear way, with humility, seriously, that helps a lot. You have the knowledge, but you are there to help these other people, and they will feel that and they will understand that. And then any conversation will be very successful. And also, don't forget that you are part of a big and strong community, which is GBHI. That gives you a lot of power. I don't know how power we have before to realize, hey, I am from GBHI. And because GBHI is behind you, it is very successful to conduct as that, as a fellow from GBHI. And also, another key step I had is to ask for help to GBHI.
Hmm.
And I was contacted for the Ministry of Health. I was scared. I got a little bit scared, seriously, because I had, oh my goodness, I know about dementia, but how I could do that big work. I didn't know exactly how. But then I connect with people from GBHI, Victor, Camelia, Sergio, my other fellows, and then provide us a lot of feedback, support, guidelines, right? Advices, and that was good. And just feel that support is good too. So I am not doing the work by my part. This is not Maritza doing the work with the dementia plan. This is a work that GBHI, through the fellows from GBHI, all together we are doing, supported with people from GBHI. So this is the good part that we have to look for the way to work with these other big institutions in my country.
Wonderful. Terrific to hear how this has come about and that there is such a strong network working on this and that you are also a big and important part of that, Maritza. So thank you for the work that you're doing. I appreciate you taking the time.
Thank you so much.